Hey everyone! Today we're going to talk about acne treatments. Acne is one of the biggest complaints in my dermatology practice. So if you stay till the end of this video, you're going to learn a step-by-step, simple yet effective regimen for your acne that you can do at home. My name is Dr. Swati Cannon, and I'm a board-certified dermatologist, a cosmetic dermatologist, and a skin cancer surgeon out here in California. There are three main types of acne lesions, and the treatment depends on the type that you have. So let's go over it. So there's comedonal acne, which is made of whiteheads and blackheads. This is not inflamed usually, but the clogged pore is the precursor of inflamed acne. 2 is inflammatory acne, where you get pus bumps and red bumps all over the face. The third type of acne is a nodulocystic acne. This is the most severe form of acne where you get these deep-seated, painful nodules and cysts underneath the skin. This one is really hard to treat with just topical medications at home. And usually this type of acne also leads to scarring, so it's better to have a more aggressive form of treatment to minimize how much scarring you get. Now, obviously, you can get a predominant version of one kind of either comedonal, inflammatory, nodulocystic acne, or you can have all three subtypes. Women can also get hormonal acne, where you get either inflammatory or nodulocystic acne, kind of along the jawline and cyst area, and it's usually worse around that time of your month. So for this kind of acne, we usually add a pill called spironolactone if the patient's a good candidate for it, because it helps the hormone component of acne. When it comes to treating acne, I usually like to do a simple regimen that consists of a cleanser, an active ingredient, and a moisturizer both in the morning and at nighttime. And then of course, in the morning, I also want you to wear sunscreen. So let's start with comedonal acne. In the morning, this would be kind of your baseline regimen. First, you start with the cleanser to clean your face. The main ingredient I like for a cleanser for comedonal acne is salicylic acid. Salicylic acid is a beta-hydroxy acid that slowly unclogs your pores over time and gets rid of whiteheads and blackheads. It can be harsh for some skin types, so you may want to use it like every other day initially, and then slowly build up use as tolerated. The main brands that I like are the CeraVe Salicylic Acid Renewal Cleanser, or the Neutrogena Salicylic Acid Cleanser, or the Paula's Choice Salicylic Acid Cleanser. I feel like these are a little bit more gentler and they're a little bit less abrasive for your skin. The gentle non-salicylic acid cleanser that you can alternate with, especially when you're starting, would be something like Cetaphil or CeraVe gentle cleansers that don't have any active ingredients in them. So the second step is to use an active ingredient either in a serum form or in a cream form. Azelaic acid is one of my favorite ingredients for acne. It's anti-inflammatory and also has properties to help with skin lightening and discoloration. It's also very safe in pregnancy compared to the other ingredients that we use for acne. Over the counter, you can find azelaic acid in its 10% strength form, but prescriptions, we usually go up to 20% if needed. I usually prefer azelaic acid as a serum or a gel because it penetrates better, and it is gentler than other acids, but you can still irritate your skin if you overload it. The way you apply it is that you take a pea-sized amount, just a pea, and you go dot, 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 and kind of apply it to your entire face. And make sure you also get a little bit on your neck because you don't want to treat your face and then leave your neck untreated. My favorite azelaic acid forms over the counter is the ordinary 10% azelaic acid, and then Natrium also makes one azelaic acid with niacinamide and vitamin C. I think this one is a little bit harsher because of the addition of vitamin C. So I always tell people try it, but don't, overload it on your skin. Kind of test a little area and see that you can tolerate it. The third step is a nice, helpful moisturizer. I know that if you have oily skin and acne, you may think you don't need a moisturizer, but when we're using acne ingredients like salicylic acid or even azelaic acid, we're kind of irritating the skin. So you really want to replenish the skin barrier by using moisturizers. You can use a moisturizer with sunscreen like the CeraVe AM moisturizer with sunscreen, but I still recommend that you apply extra sunscreen on top, especially because inflamed skin like acne tends to either turn redder or darker with sun exposure. Moisturizers that I like tend to be lightweight in the morning, so the Neutrogena Hydro Boost is very lightweight. You just kind of apply it and it applies really well underneath sunscreen and makeup. This is the one that I like to use in the morning. I also like the Simple brand of the hydrating gel cream. The La Roche-Posay Repair is one of my other personal favorites, but this one I do think is a little bit more expensive. And I also like the Elta MD brand. They make an AM and a PM moisturizer, so I tend to use both of them sometimes. The way you apply the moisturizer is you take actually a quarter or a dollop and put it on your entire face and neck. And then finally, the last step is to use a non-comedogenic sunscreen. A lot of patients who have acne are afraid that the sunscreen is going to make their acne worse. But if you use sunscreens with physical filters like zinc oxide or titanium dioxide, these just rest on top of the skin, and so they're not absorbed enough to worsen your acne. And my favorite sunscreen brands are, of course, the Ulta MD. They make one specifically for acne-prone skin, and it comes in a clear version and a tinted version. This particular Ulta MD one also contains hyaluronic acid and niacinamide, which just help to moisturize the skin and reduce inflammation. The La Roche-Posay Anti-Helios one gives a really nice matte finish, because I know a lot of patients who have oily skin, they want more of a matte sunscreen. And then there's another one called the Supergoop sunscreen brand, and they have a really nice tinted version that gives you either a matte finish, and then they have a glowy or a dewy version as well. So no matter what your acne regimen is, I always tell people that the sunscreen is the last step of your acne regimen, and it goes on top of everything else. And so the nighttime routine is also made of a cleanser, an active, and a moisturizer. Now, if you wear makeup and sunscreen, you definitely need to double cleanse at night. This is one of the biggest mistakes I feel like my acne patients make, is that they do not double cleanse. What is double cleanse, you ask? So double cleansing is basically using micellar water or a cleansing balm to first clean off all the makeup and dirt and oil off the pores, and you follow that up with either a foamy or a creamy, gentle cleanser that kind of just takes it all away. So for the first part of the cleansing step, to remove the makeup, I really like CeraVe's micellar water, and I also like Green Pharmacy cleansing balm. I actually use the cleansing balm for myself, and I really like it, but I can see how it might feel greasy for some people. I personally prefer foaming cleansers. I feel like the foaming action really helps to get rid of all the dirt and oil and unclogs the pores much more effectively. But if you have dry or sensitive skin, you might want to use a creamy cleanser once in a while to really get rid of all of that dirt and makeup. The brands I like are the Cetaphil or CeraVe foaming cleansers, or even the Neutrogena creamy cleanser. I personally use the Ulta MD foaming cleanser, but it's $28, so I think it's a little bit too expensive just for a cleanser. So the second step after you clean is to use a retinoid. Now, I'm sure you guys have heard so much about retinoids because it's like information overload on retinoids. But for this video's purpose, you're basically going to use an over-the-counter retinol. And the one that I really like for acne is adapalene. Adapalene used to be prescription based until it went over the counter a few years ago. And the two main brands I like for this are the different brand, which make adapalene, and then La Roche-Posay also makes the Effaclar adapalene. Adapalene is a gentle retinoid that works really well for acne. And again, you want to take a pea-sized amount, go dot, 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 and rub it all over the face. I think the biggest mistake that people make with retinoids is that they either use too much, that their skin gets really irritated, or they use it without a moisturizer. So the third step is, and you guessed it, a moisturizer. Now at nighttime, I recommend a thicker moisturizer because, well, you're going to sleep and it's okay if you have a thicker moisturizer on top. And no, I repeat again, moisturizers will not make your skin more oily. It's only going to help repair the inflamed skin barrier. So I usually recommend the CeraVe Skin Renewing Nighttime Cream. It also comes as a lotion. I also like the Ulta MD PM Cream. These both contain ceramides, which are really useful to help repair the skin barrier. So I know that while you guys are watching this video, you're going to be like, hey doc, what about the pore strips on the nose? Can I use those? And the answer to this is it's a maybe. If you have a lot of clogged pores and those tiny little like vellus hairs on your nose that look dark or that can look like blackheads, you can definitely use a pore strip. But I recommend using pore strips about once every 2 weeks to once a month. And if you are going to use it, stop the retinoid 1 to 2 days beforehand. The pore strips remove not only the blackheads and the hairs, but it also removes the lipid barrier that forms on top of your skin. So you really want to minimize how often you're using pore strips. That's why I like using chemical exfoliants like salicylic acid and sometimes even glycolic acid instead to unclog the pores. And I never recommend those masks that you see on TikTok where they're just like peeling off the skin. I never recommend that. And the reason is because the cheeks especially do not have enough sebaceous glands, which are the oil glands. So you don't make that much oil on your cheeks, and therefore you can really irritate and inflame the skin. So the next on our list was the inflammatory acne. Now the regimen for inflammatory acne is going to be very similar to the comedonal acne regimen with a few exceptions. The main ingredients I like for inflammatory acne are benzoyl peroxide, azelaic acid, and niacinamide. So for this regimen, in the morning, you can substitute a benzoyl peroxide cleanser for a salicylic acid cleanser. You can still use the salicylic acid cleanser later on once you're used to your initial acne regimen, but you should do it at nighttime. Ideally, for most people who are doing retinoids at night, you don't want to combine benzoyl peroxide and a retinoid at night. Now, there are exceptions, like when you're using other types of retinoids, but just in general, that's the rule. So step 1 is to clean your face in the morning with a benzoyl peroxide cleanser. I usually recommend recommend using a percentage of 5% or lower. Anything higher can cause more irritation, and the benefits don't really outweigh the risks at that point. CeraVe actually has a benzoyl peroxide 4% cleanser that also has niacinamide, and so this is pretty gentle on the skin while still having the benzoyl peroxide action. And then you'll use your azelaic acid with niacinamide as the Rex that I gave earlier, along with the moisturizer and sunscreen on top. And then at nighttime, the regimen is the same. Retinoid is the best ingredient for all types of acne scarring, and discoloration, but it does take a long time to work, so you usually want to give it about 3 months. So if you mainly have comedonal acne, but you get a big zit every once in a while, like I did the other day, you can try just spot treatment with benzoyl peroxide, where you take a little bit and put it on at nighttime or even in the daytime. Or you can use a hydrocolloid patch like Zip Sticker and Cos RX. These hydrocolloid band-aids basically suck out all the juice from the pimple, so it just kind of makes it less juicy. Now, if you have access to a dermatologist, you can also go to a dermatologist office where you get a little bit of a Kenalog injection right into the acne, which makes it go down within 12 to 24 hours. And finally, for nodulocystic acne, this is actually the toughest form of acne to treat. And you can try the topical regimen that I mentioned before for the other forms of acne, but it doesn't work as well for nodulocystic. For this, you really need to see a board-certified dermatologist and get some oral prescriptions. For nodulocystic acne, often we use Accutane, which I know gets a lot of hate. And I understand why. It is a medication that requires a lot of monitoring, but it also works really well for acne. Like if my kids had scarring acne, they would be getting Accutane. So that's how much most dermatologists believe in Accutane. But if a patient doesn't want it, it's not like we force it on the patient. We work with the patient to customize a regimen for them. And then finally, diet. Does it play a role? For sure. Acne is an inflammatory condition. If you eat pro-inflammatory foods, you're more likely to worsen your acne. So I usually recommend that people minimize or avoid dairy, which is a very pro-inflammatory food, as well as any white, like sugar, white flour, white pasta, or white flour pizza. Anything that is processed, all these foods are pro-inflammatory and can either worsen acne or make you more resistant to treatment. Whew, that was a lot of information. So thank you guys so much for watching. I hope that this was helpful. If you guys have any questions or comments, please let me know and I will respond. So like, comment, and follow for more evidence-based real talk about dermatology and how to best take care of your skin, hair, and nails. And again, thank you so much for coming to my channel. Stay tuned for more.